The quest to combat disease and improve the quality of human life has led to great advances in healthcare. And we are a privileged generation. Many of the most significant strides have been made in our own time.
It is considered a complex developmental disability. It typically appears during the first 3 years of life and affects a person's ability to communicate and interact with others. It is defined by a certain set of behaviors and is a spectrum disorder that affects individuals differently and to varying degrees. There is no known single cause, and for all the promising research and significant breakthroughs in 21st century medicine, there is yet no known cure for autism. As many parents of autistic children see it, most therapies today are merely designed to teach those with autism and their family how to live with autism through behavior modification. They hold no hope for an actual cure.
Well, I think it all started when we first had family members come up to us at gatherings and say there's something a little different about your son. And we, of course we were in denial. We didn't want to believe it. But
so we started bringing him to a chiropractor. And thinking that maybe if we went a chiropractic route, maybe sometimes with adjustments and doing the acupuncture, that would make a difference in his speech. That was one of our first concerns. And we noticed he had sensory issues, and we noticed that his speech wasn't coming along. So we tried it for 1.5 years, and we noticed no changes at all after 1.5 years of treatment. And then that's when a family member had mentioned to us about IMT and told us a little bit what it's all about and said, why don't you just give it a try? And not only just the IMT, but trying also with the gluten-free diet. So with a combination of going to IMT and receiving the therapy and the gluten-free diet, within a couple of months, I would say, we started noticing differences in Lee's behavior and in his speech.
Speeching, improved tremendously.
With an annual growth rate of 10 to 17%, autism is the fastest growing developmental disability in the United States. And with the continued debates over the relationship between mercury-laced childhood immunizations and the spread of this heartbreaking condition, it remains one of today's most controversial health issues, as well as one of the most challenging for medical professionals. Perhaps that is, until now. According to Ayelet Connell-Giammatteo of CenterIMT in Bloomfield, Connecticut, Integrative Manual Therapy just may be the treatment methodology capable of providing both healthcare professionals and those affected by autism with the ability to meet and overcome that challenge.
Integrative Manual Therapy was developed in Connecticut at CenterIMT, but it is practiced all over the world by trained integrative manual therapists. And we treat lots of children and adults around the world with autism and autistic-like behaviors. And we've seen significant improvements and even elimination of a lot of the behaviors associated with autism. And many of these children and adults have been able to get to full recovery using integrative manual therapy plus other types of complementary modalities.
In short, IMT practitioners are expert in evaluating a person's biological rhythms and biomechanics to identify and address the underlying causes of the dysfunction using a comprehensive and hands-on holistic approach, as well as a unique compilation of diagnostic and treatment methodologies that assess and treat pain, dysfunction, disease, and disability. IMT also integrates a wide range of treatment technologies, nutritional programs, and body-based psychotherapeutics to develop a customized solution for patients. Integrative manual therapy involves gentle, manipulative techniques to promote tissue repair, normalize structure, and restore function. More specifically, IMT techniques generally put specific forces or torques into the tissues in order to create an environment within those tissues which is conducive for tissue repair to occur.
Integrative manual therapy is different from other types of treatment approaches for autism and autistic-like behaviors. The primary way that we're different is we are in the field of structural rehabilitation, which means that we're always looking for structural dysfunction in the body that's contributing to the person's autistic behaviors. Other types of treatments for autism are functionally based. What we have found across the board internationally with our client population is that if you do integrative manual therapy first and you're able to eliminate that structural dysfunction that's essentially contributing to the person's behaviors, then you see greater changes, greater improvements using the other types of functional tools for autism. And that's how we found you get the greatest recovery from autism.
Through our experience with CenterIMT, we have just noticed miraculous difference in Lee. We bring him for treatment only once a week. compared to where we were bringing him before. When he was receiving chiropractic help, we were bringing him 3 times a week for treatment. Now it's just 1 day a week, and 1 day a week is making a miraculous difference in Lee compared to the 1.5 years of 3 days a week of treatment where we saw no difference in him. CenterIMT has really shown us the link between gluten and autism. So with treatment once a week and the gluten-free diet, together the two of them have really, in a short amount of time, have really made our son whole. And what we have really been praying for and hoping for a cure to autism. And for any parents out there who don't feel there's hope, or they're tired of the same treatments that they've been going over and over and not seeing results, that's where we were at. We were at for 1.5 years until we discovered CenterIMT. And with his treatments and with the gluten-free diet,
that's correct.
We have just noticed a miraculous difference in our son, and we will continue to do what we've been doing, and it's a lifestyle change for us, but a good one. And we just hope for any parent out there that you give it a try, because that's what we were told, and we're very grateful to it.
Yes, because there is hope. There is hope. You don't have to sit there at home and cry every night wondering, why isn't my child like everyone else? The gluten-free diet and the therapy really, really make a difference. Really does.
Hand over hand. Hand over hand. Hand over hand. Come on. Get in.
If you or someone you know has a loved one with autism and would like to know more about IMT, contact CenterIMT at 188-306-6571 or visit www.centerimt.com.